Tonight, more than 300% increase in active COVID-19 cases with just 25 days into 2021. We have details as Ghana's coronavirus cases continue to surge with more deaths and severely ill people.
The number of people who are sick, the proportion of people who are falling sick is significantly high. It's about 32 compared to 21% earlier. For what we have, about 32% compared to the previous one, even if you use the same system we're using, the number of people who are falling sick here are much higher than before.
The Ghana Health Service has confirmed the infections has once again spread to all 16 regions of the country, with more than half of the new cases within the Greater Accra region.
So in January 21st and 22nd alone, we have confirmed 646 new cases from 17 districts and 8 regions. For what we have, about 32%, the number of people who are falling sick here are much higher than before.
Top story is brought to you by Vodafone. The features exciting ready. Balakwa Mineral Water and Gasm Cement, the nation builder. My name is Ernest Manu. Tonight, Ghana may be heading for a possible lockdown as active cases of coronavirus have increased by more than 300% in just 4 weeks into 2021. Now, Ghana's active COVID-19 cases as at the 31st of December 2020 stood at 842. But with just 25 days into 2021, the cases have shot up to 3,525, representing an increase of 318%. At a press briefing on Ghana's coronavirus situation, Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaje, said the new set of cases being recorded are more severe, leaving many people in the hospitals. Listen to him give the details.
The active cases I can see here continues to rise. It's going up, and we need to really work on that. That's just a summary, just an indication of what we are talking about. In the same way, the number of tests being done is also increasing in response to the positive case. As we say, as you have more positive, you have more contacts, and of course we do more tests. And so we are doing a lot more tests than we were doing prior to this current surge. Distribution of even the current cases still remains about the same. It's really not much. It's about still the aged, the middle aged, and the children are still quite low. What we are also noticing is that unlike the previous one, this current surge, the number of people who are sick, the proportion of people who are falling sick is significantly high. It's about 32 compared to 21% earlier. And so this is... but I'm sure there are still people who, because of the way things are going, are not reporting, and they may not have symptoms. But for what we have, about 32% compared to the previous one, even if you use the same system we're using, the number of people who are falling sick here are much higher than before.
So he also confirmed that the COVID-19 virus has once again spread to all 16 regions of the country, with Greater Accra, Ashanti, and the Western region the biggest hotspots.
What we are also noticing is that, unlike the previous one, this current surge, the number of people who are sick, the proportion of people who are falling sick is significantly high. It's about 32 compared to 21% earlier. And so this is... but I'm sure there are still people who, because of the way things are going, are not reporting, and they may not have symptoms. But for what we have, about 32% compared to the previous one, even if you use the same system we're using, the number of people who are falling sick here are much higher than before. So in January alone, we have confirmed 640, January 21st, 22nd alone, we have confirmed 646 new cases from 17 districts and 8 regions. Kwale, Klote, Ayawaso are the key areas where we are reporting the cases. Ashanti has 37 new cases in 11 districts in Accra Metro. Eastern region has 19 cases in 2 districts. Western region has 16 cases, all in Secondary Accra. The Upper East has 14 cases in Bogatanga municipality, and Northern region has 4 cases from Tamale metro. So these are the numbers we are currently dealing with. Ahafo has 2 cases, Volta has 1 new case, and the remaining 8 regions had no case. But they are having some active cases who are yet to recover. So if you look at, for example, Greater Accra, you can see that it's still concentrated in Accra Metro and its environs, whereas the districts far away from Accra remain relatively low prevalence. So you can see that between 1st and 22nd of January, Jowolo, which has a treatment, a testing center, like it has about 574 cases. And these are the number of districts that has reported more than 10 cases in this period. And that tells you that the situation is quite alarming, and we need to look at that. Almost every district in Greater Accra is involved. This is a national and nationwide, but you can see that mainly Accra districts are the one reporting cases more than 10 and above.
So that's the Director General of the Ghana Health Service, Dr. Patrick Kumar-Boadjeh. We'll bring you more on what he's been saying at today's news conference. But my colleague Manuel Cranton joins me in the studio. In the last few minutes, there have been an update on the website of the Ghana Health Service. More cases, more deaths. Manuel, give us the figures.
Yeah, so Ernest, definitely more cases and more deaths. Just before we came on air, the update as of 21st January 2021, our active cases stood at 3,525, and that's the figure you've been referring to.
Exactly.
But just as we came on air, then the numbers have increased to 3,613. With 646 new cases, and that's not all. There are also been 5 new deaths. So before this particular update, which is update for 22nd January 2021, deaths stood at 367. Now we are doing 372. That's 5 more deaths in just the space of the 2 updates, Ernest.
So 5 more deaths and a few more cases as well. The figures are definitely going up. But Manuel, at the news conference, and this is just the latest, and so if you're joining us, the cases have actually gone up in the last few minutes. 5 more people have died of COVID-19. As updated by the Ghana Health Service. And Manuel, you were at the news conference today held at the Information Ministry. Did Dr. Patrick Kumar-Boadjeh give us what is accounting for the sharp rise we are seeing in the figures? Because this is about the 3rd update they're doing just today.
In just about 24 hours, the 3rd update. And we're doing 62,135 confirmed cases. And that's quite worrying. But, I mean, he's been talking about the reasons we're having these numbers. He mentioned that the non-adherence to safety protocols during especially the festivities and some others, which included the new cases we're recording at the airport. And so quite a number of positive cases are being recorded at the airport under the new testing regime that we're having there.
Though we have not demonstrated the variant, the new variant, that's the South African and the UK one, within our community set, which we are still doing. As you know, when we isolated people at the airport who tested positive, we found cases of the UK variant and a case of the South African variant amongst them. The chances are that we may have them, and that may be responsible for the increasing number of spread. But the search will continue to see whether we actually have a community presence of the variant in this country. And we looked at maybe it's a variant that has come to the whole of the West Coast that is actually spreading, especially if you see the number coming from Nigeria into the country and other parts of the world where we have the variants. The increase in the number of tests conducted by the lab has also, because of the response, definitely we need to continue doing the more tests, identify most positive, and look at isolating them. Obviously, the non-adherence to the protocol is a major challenge. I'm sure when we've not done assessment, but we're going to start one this week. Ever since people started seeing the surge, I can see the mask wearing is improving. And the increased number of positive travelers is also creating a problem as part of that. The non-adherence of safety protocols during parties and all other unauthorized places where people are not supposed to be is also part of the problem that we are facing. Obviously, people are also walking in to have a test, and there's unlinked to anything, so it takes a few days longer before they're identified and isolated. That's also creating part of the challenge that we're facing.
And so that is Dr. Patrick Kumar Boaji giving us the breakdown and what is accounting for the sharp rise that we are seeing in the COVID-19 cases. There have been calls for new measures to be adopted or introduced by government. Information Minister Kojo Ponkumah responded to that.
Yes, he did, and his response was plain and simple, that emphasizing that if this current trend that we have persists, I mean, a lockdown and, if you like, further restrictions is inevitable.
Increase the number of tests conducted by the lab has also, because of the response, definitely.
We have a limited number of beds and ICU facilities for severe and critical. So it's very important that we ensure that the positive numbers go down, because if this trend continues, as His Excellency the President mentioned, we will be overwhelmed if this trend continues. Is there the possibility of a lockdown or introducing some more restrictions at some point in time? Yes, there is that possibility, and if this trend continues, that is where we are heading. I want to be very clear about that one. Yes, there's the possibility of some more restrictions being introduced, but especially as this trend is going, if it continues, then that is exactly where we are heading. We are being reminded that we all need to do the things that we were doing in the beginning that would ensure that this third rise, we can quickly curb it. Because the dynamics of this third rise appear to be a bit different from the first two that we had, including the number of people who are falling sick, severe and critical, as we discussed. So, especially if these numbers keep going, average daily new cases of 200, if it keeps rising to 210, 250, then in 5 days you are hitting about 1,000 plus. If it keeps going the way it is going, I think, as the President himself articulated, then we are heading for some more restrictions. And if it means reviewing some of the legal instruments, yes, that is where we will be heading.
And so earlier you had Kojo Ponkumah, who is Information Minister Designate. Let's go to the phone lines now and speak to Senior Researcher at the Kumasi Center for Collaborative Research, Dr. John Amoisi. Thank you very much, Doc, for joining us here on Top Story. Today alone, we've had 3 updates. In the last few minutes, the Ghana Health Service updated its website. 88 new cases added, so we stand now at 3,613. 5 more deaths, bringing the death toll now to 372. How long should we wait before we introduce the new restrictions or possibly a lockdown?
No, thanks for those questions, and good evening to all the listeners all over the country and the world. I think we're in dire straits at this time, and we are in a grim situation at this moment. In my candid opinion, looking at the way things are going, they're going just as had been predicted. We should waste no time in introducing measures that would restrict the gathering of people and the movement of people with the intention of reducing the spread. There are a bunch of things going on here. The first one is what is accounting for what we're seeing. The first thing is the Christmas festivities and the way we went about this. This has been very clear. Government themselves have indicated that they believe this has been the main catalyst. But there's an additional spanner in the works, which is the new variants. Both the South African variant and the UK variant have all been shown to increase the rate of spread or the risk of spread by almost 70%. So when you combine these two things, the laxity of the measures or lack of adherence to the measures, as the Ghana Health Service boss himself has reiterated several times, with the evolution of the virus or the mutations to the new variant, it's a lethal cocktail, which has led us to where we are now. There is nothing else which will stem the tide. And I keep hearing, if we don't see the numbers going down, the numbers will not go down until we take decisive measures. From where I sit, I think that the Ghana Health Service, the Ministry of Health, the government is taking these measures. They're just trying to plan them out and roll them out because it just can't, just appear boom and say lockdown. So I would take these as a herald or a a pre-announcement, if I can put it that way, from where I sit. This is my understanding that this is going to happen sooner than later.
So sooner than later, what form and shape should this lockdown take? Are you looking at the areas with the number of hotspots? For instance, they mentioned the Greater Accra region. They mentioned the Western region as well. Do you think that we should just have lockdowns in some of these areas, or it should be a nationwide lockdown? What form and shape would you advise we roll this out?
Right. So from where I sit, I'll propose a two-pronged measure. First, in major cities like Accra and Kumasi, and perhaps in Takoradi, I would recommend a complete lockdown, which would restrict the movement of people to stay at home, except the essential services and so on. We've done this before. And for the rest of the country, a more kind of circumscribed lockdown, which would prevent people from moving out of the district or out of the region. So the major roads out of the district or out of the region would be manned, and people will not be allowed to move. So that maybe within those regions where there's less number of people, there can be the enforcement of all the measures, but not necessarily a strict lockdown, because some regions have this 2 cases, 14 cases. Of course, there would be more than that. We're just talking about people who have tested positive, but maybe too early to have a complete lockdown across the entire country. So for major cities, full lockdown like we did previously. For the rest of the cities, more of a circumscribed thing where people are not allowed to get out of the region or out of the district. And then let's measure after a week or two. Well, to be honest, if we really want to make this work in Kumasi or Accra, we would need at least 2 weeks to see even a slight dip in the numbers.
The first time I should say that we introduced a lockdown, we had cases only in Kumasi, Accra, and some parts of the Western region. The lockdown was not nationwide, but eventually, by the time the restrictions were lifted and eased, the lockdown, over, we saw the other regions record cases. Now, as we speak, all 16 regions have cases, and so how do you put that, that suggestion, that solution that you are proposing within this context?
Yeah, so what I was explaining to you, maybe I'll try and put it a bit differently, was you have a hugely varied situation. The numbers are very different from region to region, with the major places being Accra, Kumasi, Takoradi, and I think the Upper East as well, and with fewer numbers in the other regions. A complete lockdown is hugely disruptive, not only to people's lives, but ultimately to the economy. And we saw the impact that it made upon the country and on our lives. However, this can be attenuated in a way. So you lock down those major cities where there's huge cases, not just huge number of cases, but also the population density is very high. So the risk of spread is several-fold higher than in other places. And then for the other places with fewer cases, what you do is you have a more circumscribed kind of lockdown. So yes, you can feel free to move within the region, but you're not allowed out of that region. At the same time, you try and enforce some of the preventive measures which we know already, and you monitor the situation. But to prescribe an entire national lockdown at this time, I just don't know practically how that's going to work out. I'm just trying to be realistic here. That a full national lockdown would have been the best thing to do, if our focus was only on the virus. But there's several moving parts here, which would, I think, make that very difficult. But definitely for Accra, Kumasi, Takoradi, it is very clear that a strong lockdown and restriction of movement and activity is needed urgently. It was needed yesterday.
Now, Dr. Mercy, let's talk about the testing regime. There have been calls for the reduction of the cost of testing to allow a lot more people, test voluntarily. I'm wondering how significant this will be should government heed to these calls, because it doesn't appear for now it is something which is on the plate of government. But should government heed to these calls, I'm wondering what significant difference this will make in the face of the new variants that we are seeing and that we are handling.
No, I think testing is key. It's absolutely key to our ability to formulate and implement policy which would allow us to be successful in our fight against this virus. Without the testing, you're literally going in blind. and you cannot tell to what degree you need to do things, and you cannot tell to what degree you are successful or otherwise. So the major barrier to testing is not necessarily the capacity, it is the cost, all right? So it makes sense that calls for reduction in the cost of testing are made, and that people are able to test more. However, I know that there have even been calls beyond Ghana, even at the ECOWAS region. I was listening to Radio France International this morning, and there have been calls across the ECOWAS region for harmonized cost of testing, at least for travelers. I don't know how far this is going to trickle down to the general population, but the earlier we make testing available, as readily available as possible, the better for us, and will make a big difference. What will happen is that when this testing is made readily available, our case numbers will soar, because then we will see the real picture, because people are going to be testing en masse, and the positives are going to be popping up en masse. This should not be a cause for alarm. It only means you're seeing more clearly. When you see more clearly, you can act more decisively, and you can get this done and over with much quicker. So definitely I support a call for increased testing and for reduction in cost.
Until that happens, the issue of vaccination is the other alternative. We know that government has instituted measures to get us the vaccine, but before they arrive, already we are learning that in the UK, some people who have taken the jabs are still transmitting the virus. How should we be concerned about the efficacy of this vaccine?
Well, it depends on what kind of vaccine you're talking about. Maybe we can restrict ourselves to the ones that have been approved, because you made mention of the UK, or maybe in the US, like the Moderna vaccine, the Pfizer vaccine, and then the AstraZeneca vaccine. The good news that's coming out, just breaking earlier today, barely an hour or so ago, is there is evidence that the vaccine is efficacious against, or does protect against, the new variant. What we do not know is the degree to which that protection is reduced on account of the new variant. I'm not surprised that the vaccine is effective against the new variant. My question has been more, is it still at that high level of about 95% for the Pfizer vaccine and 90 plus for the Moderna vaccine, or is this reduced to some degree? So for me, what this speaks to is the need for us to engage in studies or in activities which allow us to measure the seroprevalence of the disease in this country. This is so critical to inform the way in which we roll out the vaccine. So some people have been exposed, some people have been sick. Do they have the antibodies or not? To what levels are these antibodies? To what degree are they being protected? Do they need to have the vaccine? On how much of it should they have? Because we will have very limited stock. And if you knew the seroprevalence, you could do a bit more targeted vaccine distribution. But definitely, the vaccine will be a game changer. We should push for it and continue to monitor our situation. As the Ghana Service boss himself said, there is evidence that the new variants, both the South Africa variant and the UK variant, are in the country. The risk of spread of the vaccine is about 70% higher, and the risk of severe disease on account of this new variant is also much higher. In fact, if you're looking at, if out of 10,000, out of 1,000 people who get the virus, if about 10 people die, for the new variant, you're having about almost a 50% increase. So you're having about maybe 13 to 14 people out of 1,000 who get the virus will be dying. And that's significant if you should escalate this using this economies of scale.
Dr. John Amwese, I want to thank you very much for your time here on Top Story. That's Dr. John Amwese, researcher at the Kumasi Center for Collaborative Research. As I indicated earlier, all 16 regions, according to the Ghana Health Service, have cases of COVID-19. But there's growing resentment among caregivers at the Konfo-Anokye Teaching Hospital over the management of COVID-19 cases at the facility. 8 confirmed cases have been recorded at the Child Health Directorate in the last few weeks. The caregivers accuse management of putting their lives at risk as suspected COVID-19 cases are managed alongside other patients. Ohimiteri has been following the story, and here's his report.
Doctors and nurses at the Konfo-Anokye Teaching Hospital's Child Health Directorate say there's no concerted effort by management to either test staff who come into contact with COVID-19 cases or close down wards for fumigation.
We have been told that we cannot refuse care to anybody. So I think our facilities are doing their best not to return anybody who walks into the facility being ill. And by so doing, they are also increasing the exposure rates of every other person around. It's been almost a week now, but nobody has been called or contacted about testing the staff nor the relatives. A lot of us are embittered by it. We keep complaining, we keep passing comments. But I mean, we can only talk in the background. If there is anything that can be done, it is about management helping us out.
A nurse who spoke on condition of anonymity says the over 400 caregivers are compelled to work without the right protective gear. She says the development puts their immediate families and that of the public at risk.
There has been a clear line in that we should have frontline health workers who have been trained specifically for the management of COVID-19. But as it stands, it looks like every health worker is capable of managing COVID-19 at any little space on the ward, which is not supposed to be so. It exposes both the patient, the health workers, as well as the relatives who come around these patients. And it makes managing COVID-19 quite difficult because we know that COVID-19 should be managed, 1, in an isolation, 2, by trained professionals, and 3, with specific PPEs. And all these 3 things are being lacked. We initially had suspected, and getting results was a problem. Finally, when they became confirmed, we had to manage them on the ward. Because as we are being told, there is currently no trained personnel and no specific place to keep those patients.
I am Intera filed that report, and we have more on COVID-19 for you later on Newsnight. Top story is brought to you by Balakwa Mineral Water, Vodafone, the features exciting, ready, and Gas and Cement, the nation builder.